Hi, I'm Mark Drennan with the West Virginia Behavioral Health Care Providers Association. We're going to be doing a series of videos focused on saving taxpayer dollars through streamlining government inefficiencies. Our videos are not meant to place any blame, just merely point out different areas where we believe there are cost savings, efficiencies to be had that will drive more of the dollar away from administrative costs and directly to those who are seeking the services to begin with. We hope you enjoy. If you have any questions about these, we'll certainly be able to give you our contact information so that you can contact us directly. Thanks. Hello, today's video is going to focus on the entity that is responsible for licensing and regulating behavioral health centers across the state of West Virginia, OHFLAC. It's the Office of Health Facility Licensure and Certification. There's a section of the West Virginia Code that is the licensing rule for behavioral health centers. It's 64 CSR 11. We believe, and I think that the individuals at OHFLAC and others within DHHR would agree, that 64 CSR 11 is an outdated rule and much in need of updating. In fact, several years back, OHFLAC, DHHR, the providers, and many others worked diligently for more than a year to rewrite and revise and bring into the modern era 64 CSR 11. Be our recommendation to the incoming administration, to this legislature, to look at that revision and consider updating it. Some of the things that we think would be helpful within that rule is extending the license from 2 years to 3 years. That adds an additional year where we're not sending out reviewers out into the state at the taxpayer expense to review licensed entities. That doesn't preclude OHFLAC from going out and making complaint investigations. It just extends that license from 2 years to 3 years. What that also does is it coincides with accrediting bodies, which are likely to be 3 years as well. So if providers were to seek accreditation, we would also ask that we add a deemed status provision within 64 CSR 11. This would allow providers that seek an additional level of scrutiny through accreditation the ability to be exempted from licensure review if they meet the standards in the various accrediting bodies. So those are two, that's just an easy recommendation that we believe will save some costs. Last year, the legislature passed a rule regulating medication-assisted treatment. Medication-assisted treatment is a term that is used for providers that deliver buprenorphine treatment for individuals who suffer from opiate addictions. We support regulating medication-assisted treatment. What was happening at the time is legislature, as they should have, was cracking down on pain clinics. So pain clinics were feeling the pressure. So what happened sometimes were pain clinics were shutting down as a pain clinic and then opening up as a medication-assisted treatment provider. And it was really important that we regulate those individuals. However, behavioral health providers are already regulated. They already have a license. They already have visits. They already have to pay the necessary fees and have the necessary reviews through 64 CSR 11. There are a multitude of services that our members provide under that license, and medication-assisted treatment is one of those. So what we would recommend is that behavioral health providers be exempted from that rule. Therefore, they wouldn't have to seek an additional level of licensure and bureaucracy when they're already covered under their current license. We support the medication-assisted treatment rule applying to those individuals, those companies that do not have a behavioral health license. Those are just two ways that we believe we can save the state of West Virginia and providers funds and monies and drive the dollar directly to those people that need it. We'll be doing more of these videos. You can find our contact information in the Twitter heading or on Facebook. You can also find us on our website at wvbehavioralhealth.org. Thanks.